The cranial nerve number 5, trigeminal nerve, or nervus trigeminus. It is a mixed nerve with four separate nuclei. One of them is a motor and three other are sensory nuclei. The motor nucleus or nucleus motorius nervi trigemini projects on top of the eminentia medialis, just above the colliculus facialis here. The main sensory nucleus, or the nucleus principalis nervi trigemini, or nucleus sensorius nervi trigemini, projects just lateral to the motor one, approximately here, laterally to the sulcus limitans. Two remaining nuclei, nucleus mesencephalicus nervi trigemini and nucleus spinalis nervi trigemini, extends upward and downward respectively to the mesencephalon and to the cervical segments of the spinal cord. An approximate localization of this nuclei is here in that cross-section specimen, and here you may see also the fibers of the nervus trigeminus, which comes out from the pons, in between the mass of the pons and the pedunculus cerebellaris medius. Pons, pedunculus cerebellaris medius, and here you see the nervus trigeminus. Fibers that goes to the sensory nuclei of the trigeminal nerve are called radix sensorius, and the fibers from the motor nucleus of the trigeminal is called radix motorius nervi trigemini. Of course, the sensory radix is much larger compared with the motor one. The same on the other side. After passing a short distance within the subarachnoidal space, the nervus trigeminus, here it is, with the sensory and motor root. The nervus trigeminus finally penetrates the dura mater and forms a large and flat ganglion trigeminale. This ganglion contains pseudo-unipolar sensory neuron cells, bodies of these neurons. From that ganglion, the three main branches of the nervus trigeminus begins. That's first branch, nervus ophthalmicus, the second one, nervus maxillaris, and the third one, nervus mandibularis. The first branch of the trigeminal, the nervus ophthalmicus, sensory branch that enters the orbit through the fissura orbitalis superior. Before doing that, nerves gives the side branch ramus tentori that innervates the tentorium cerebelli, the dura that separates cerebellum from the hemispheres. Within the orbit, nervus ophthalmicus splits into three main branches: nervus frontalis, nervus lacrimalis, and difficult to show, should be somewhere closer to the medial wall of the orbit, the nervus nasociliaris. The nervus frontalis you may see on that specimen. Here the upper wall of the orbit is removed, so you can see that the nervus frontalis occupies the uppermost position practically between the wall of the orbit and the musculus levator palpebrae superioris. Within the orbit, nervus frontalis splits into two main branches: nervus supraorbitalis and nervus supratrochlearis. Here they are: nervus supraorbitalis and nervus supratrochlearis. Supraorbitalis in this case uses the foramen supraorbitale, but nervus supratrochlearis bends around the incisura frontalis. Nervus supraorbitalis, which is more lateral one, innervates the skin of the scalp up to the sutura lambdoidea, while the nervus supratrochlearis innervates only the medial portion of the skin here in front, plus the radix nasi and a little bit the conjunctiva of the upper medial quadrant, including the conjunctiva of upper eyelid. The second branch of the nervus ophthalmicus is nervus lacrimalis. Here it is. It passes through the lacrimal gland, lacrimal gland, as you know, localizes in the upper lateral corner of the orbit within the fossa lacrimalis. And after passing through the gland, the fibers of that nerve innervates the upper lateral corner quadrant of the conjunctiva. Shortly before entering the glandula lacrimalis, the nervus lacrimalis receives parasympathetic fibers, postganglionary parasympathetic fibers from the nervus zygomaticus. The name for that connecting branch is ramus communicans cum nervo zygomatico, and it brings to the lacrimal nerve the postganglionary parasympathetic fibers from the ganglion pterygopalatinum. These fibers innervates the glandular cells. The last one branch of the nervus ophthalmicus is nervus nasociliaris. This is a small nerve which passes along the upper margin of the musculus rectus oculi medialis, with the terminal branches, the nervus nasociliaris, reach this region. The terminal branch of this nerve is called nervus infratrochlearis, stressing the fact that it is localized below the trochlea. Nervus infratrochlearis innervates the skin close to the radix nasi, the conjunctiva around the medial corner of an eye, and the sacculus lacrimalis. Nervus nasociliaris gives multiple side branches. Nervus ethmoidalis posterior, nervus ethmoidalis anterior, and nervi ciliaris longi. Not all of them are directly observable, but I will show at least what you should be able to demonstrate when we discuss them. Nervus ethmoidalis posterior passes through the foramen ethmoidale posterius and innervates these ethmoid cells, posterior ethmoid cells. Nervus ethmoidalis anterior is with a very complex pathway First of all, it passes through the foramen ethmoidale anterius from the orbit to the fossa cranii anterior. This foramen ethmoidale anterius is rather the channel, it is long. And during that passage, nervus ethmoidalis anterior already innervates the middle and anterior ethmoid cells as well as sinus frontalis. After reaching the fossa cranii anterior, nervus ethmoidalis anterior innervates the dura mater in this region with the rami meningae. Finally, nervus ethmoidalis anterior passes through the lamina cribrosa, through the cribra ethmoidalis, and reach the cavitas nasi with rami nasalis interni. This nerve innervates the anterior portion of the nasal cavity mucosa, and with the terminal branch, the nervus ethmoidalis anterior, the terminal branch is called ramus nasalis externus, innervate the skin of the dorsum nasi and apex nasi. Finally, the last one branch of the nasociliary nerve is that complex. It contains not only nervi ciliaris longi, but also some other nerves. However, it is not possible to be sure where here we have nervi ciliaris longi, nervi ciliaris brevis, where is the ganglion ciliare. By the way, you can call these branches nervi ciliaris longi, and they enters the eye bulb passes between the sclera and choroidea to innervate the cornea. Plus, during that passage, nervi ciliaris receives sympathetic input from the sympathetic plexus around the arteria carotis interna, and these sympathetic fibers travels together with the ciliary nerve and innervates a musculus dilatator pupillae. The second nervus trigeminus branch is nervus maxillaris. Here you can see that nerve which comes from the ganglion trigeminale and goes forward into the foramen rotundum. Before entering foramen rotundum, nervus maxillaris gives small side branches, rami meningae, that innervates the dura mater of the fossa cranii media. Before continuing with the nervus maxillaris branches, let's first discuss the topography related to that nerve. So, here it is, the foramen rotundum, through which nerves passes and enters the fossa pterigopalatina. Here you see that fossa through the fissura pterigomaxillaris, and that's another way how to look into that fossa, through the orbit and fissura orbitalis inferior. That's not all. There are few more openings that connects fossa pterigopalatina with other compartments. For example, this opening, foramen sphenopalatinum, that connects fossa pterigopalatina with the nasal cavity, or that canal, canalis palatinus major, and also smaller canalis palatini minoris, that connects fossa pterigopalatina with the oral cavity. All these openings and canals and fissures are used by different branches of the nervus maxillaris. So let's talk about that. Immediately after entering fossa pterigopalatina, nervus maxillaris gives small branches to the parasympathetic ganglion pterigopalatinum. These branches are called radix sensoria, so sensory branches for this ganglion. And this is one of the largest branch of the nervus maxillaris, the nervus infraorbitalis. Nervus infraorbitalis leave the fossa pterigopalatina through the fissura orbitalis inferior and enters orbit. Here in orbit, the nervus infraorbitalis occupies the sulcus infraorbitalis and then enters the canalis infraorbitalis. Canalis infraorbitalis opens through the foramen infraorbitale, and here at the level of that opening, the nervus infraorbitalis finally splits into the terminal branches that altogether are called pes anserina minor, or small goose foot. why such a name you can see here. Depending on where these branches goes, they are called rami palpebralis inferioris, rami nasalis, or rami labialis superioris. Of course, they innervate lower palpebra with the conjunctiva nasus externus, the skin of the nasus externus and ala nasi, and the skin of the upper lip respectively, skin and the mucosa of the upper lip. That's not all about the nervus infraorbitalis. There are also few side branches, and we can see one of them. Here it is. This is ramus alveolaris superior posterior, or rami alveolaris if they are multiple. Usually they are multiple. Rami alveolaris superioris posterioris comes from the fossa pterygopalatina through the fissura pterygomaxillaris and find their foramina alveolaria on the tuber maxilla region. Through that foramina, ramus alveolaris superior posterior enters the canal system within the maxilla, and through these small canals then reach the plexus dentalis superior. Plexus dentalis superior localizes within the maxilla bone and projects to the arcus alveolaris superior. This plexus dentalis superior innervates the teeth and the gingiva around them, upper teeth, of course. As you understand, this is not the only ramus alveolaris superior. We have also rami alveolaris superioris medi and rami alveolaris superioris anterioris that comes from the nervus infraorbitalis more distally, but we cannot see them directly on our specimens. The next branch of the nervus maxillaris you should know is nervus zygomaticus. Here it is. Just like the nervus infraorbitalis, the nervus zygomaticus also enter orbit through the fissura orbitalis inferior. Then the nervus zygomaticus passes along the inferolateral wall of the orbit and approaches this opening here, foramen zygomatico orbitale. Through that foramen zygomatico orbitale, nervus zygomaticus enters the zygomatic bone and splits into two types of branches, rami zygomatico facialis and rami zygomatico temporalis. Rami zygomatico facialis then after passing through the canal system within the zygomatic bones comes from these openings with the same name and innervates the skin of the zygomatic region, and rami zygomatico temporalis leaves the zygomatic bone through the foramina zygomatico temporale and innervate the skin of the temporal region. It's a bit easier to see that openings in the skull Here it is, the foramen zygomatico orbitale, through which nervus zygomaticus enters the zygomatic bone. Here are the foramina zygomatico faciale and foramen zygomatico temporale. One more fact about the nervus zygomaticus. There is a segment of that nerve that contains the parasympathetic fibers. What does it mean? Within the fossa pterygopalatina, the parasympathetic fibers from the ganglion pterygopalatinum joins the nervus zygomaticus and follows that nerve up to that point. Here, the parasympathetic fibers detach from the nervus zygomaticus as ramus communicans cum nervo zygomatico, thanks to the small blood vessels that accompany that nerve, so we can approximately see where it should be. And this parasympathetic fibers then ascends and join the nervus lacrimalis. Together with the lacrimal nerve, then these parasympathetic fibers finally reach and innervate the glandula lacrimalis. Other branches of the nervus maxillaris are nervus palatinus major and nervi palatini minores. Nervus palatinus major, as you understand, pass through the canalis palatinus major and here innervates the mucosa of the palatum durum, while the nervi palatini minores that uses the canalis palatini minores innervates the soft palate mucosa. Finally, the last one branch from the nervus maxillaris, which uses that opening, foramen sphenopalatinum. These are nervi nasales posteriores superiores. Nervi nasales posteriores superiores passing through that foramen sphenopalatinum innervates the posterior part of the nasal cavity, here on the lateral wall of the nasal cavity, but also on the septum nasi as well. The branches that innervate the mucosa on the lateral surface of the nasal cavity are called nervi nasales posteriores superiores lateralis, and the branches that joins the septum nasi are called nervus nasalis posterior superior medialis. This medial branch then passes obliquely along the septum nasi and finally reach the canalis incisivus. Through that channel, nervus nervus nasalis, or more precisely the terminal branch of the nervus nasalis posterior superior medialis, which is nervus nasopalatinus, innervates that portion of the palatum durum. Finally, the last one branch of the trigeminal nerve is the nervus mandibularis. This is the largest branch of the trigeminal, and it passes through the foramen ovale. Foramen ovale connects fossa cranii media to the fossa infratemporalis. So the nervus mandibularis ramifies from that point. And the first branch to mention is ramus meningeus, which goes back to the fossa cranii media through the foramen spinosum. Foramen spinosum localizes just dorsally and a bit laterally to the foramen ovale. This opening is used also by the arteria meningea media, the middle meningeal artery, which supplies the dura mater in the fossa cranii media and also on the level of the calvaria. And the ramus meningeus from the nervus mandibularis innervates the same portion of the dura mater. The next branches of the nervus mandibularis are these fibers that are not attached to anything, but they are motor fibers. They are motor nerves that innervates muscles that derivates from the first pharyngeal arch. And they are, first of all, mastication muscles, musculus pterygoideus lateralis, musculus pterygoideus medialis, musculus temporalis, and musculus masseter. All of them receives innervation from the mandibular nerve with the names for these nerves that corresponds to the innervating muscles. So musculus temporalis receives nervi temporalis profundi, musculus pterygoideus lateralis et medialis, respectively nervus pterygoideus lateralis et medialis, and then musculus masseter is innervated by the nervus massetericus. Plus, these motor fibers also innervate some smaller derivates of the first pharyngeal arch, like musculus tensor tympani and musculus tensor veli palatini. And now let's switch to the largest branches of the nervus mandibularis, and they are 4. To remember them, I personally use abbreviation ALBA that encodes nervus auriculotemporalis, nervus lingualis, nervus buccalis, and nervus alveolaris inferior. Let's first of all discuss the nervus auriculotemporalis. At the beginning, the nerve is almost horizontal path, has almost horizontal path. Then, after reaching the arcus zygomaticus, which is removed here, it turns 90 degrees and innervates a lot of structures in the temporal region and close to that region. But let's first of all look closer to the very proximal segment of that nerve, which is very well seen here. The nervus auriculotemporalis at the beginning splits into two radices. This radices surrounds the arteria meningea media, already mentioned artery. Then this radices rejoins and makes a common nerve. The branches of the nervus auriculotemporalis include temporal branches for the skin of the temporal region, nervi auricularis anterioris innervating the tragus and a ventral portion of the helix, plus also fibers for the meatus acousticus externus and tympanum, plus the nervus auriculotemporalis is associated with this ganglion. This is ganglion oticum, the parasympathetic ganglion sitting just medial to the glandula parotis within the fossa infratemporalis. The ganglion receives sensory fibers from the nervus mandibularis. These are the radix sensoria for the otic ganglion. And then it receives also the parasympathetic and sympathetic fibers. But the postganglionary parasympathetic fibers rejoins the nervus auriculotemporalis, and together with that nerve enters the glandula parotis mass. Then postganglionary fibers from the ganglion oticum detaches and innervates that gland. The next nerve to discuss is nervus lingualis. Sensory nerve which obliquely goes down just medial to the ramus mandibulae and lateral to the musculus styloglossus and hyoglossus. It makes a kind of a loop below the tongue and then goes up with the rami lingualis that innervates dorsum of the linguae and the apex of the linguae, plus with the fibers, so-called nervus sublingualis, innervates the floor, the mucosa of the floor of the of the oral cavity. In strict anatomical terms, the nervus lingualis from the nervus trigeminus contains only general sensory afferents that receives touch, pain and temperature impulses from the tongue. However, at that level, the rami lingualis are mixed with the specific visceral afferent fibers from another nerve, from the cranial nerve number 7. And these specific visceral afferents that collects the taste information from the same dorsum and apex lingua belong to the chorda tympani, which travel together with the nervus lingualis, and here, very close to the foramen ovale, just 1.5–2 centimeters below the foramen ovale, chorda tympani fibers completely detaches from the nervus lingualis and continues and enters the fissura petrotympanica. Plus some other smaller fibers from the nervus lingualis innervates also the mucosa of the arcus palatoglossus and the faux falsi. The next branch of the nervus mandibularis is that it is nervus buccalis. Even better view on that nerve is in that specimen. This is nervus buccalis. The first segment of that nerve localizes medially to the ramus mandibula, and then laterally to the musculus buccinator. The fibers from the nervus buccalis innervates the skin of the cheek. However, some fibers from that nerve penetrates musculus buccinator mass and innervates the mucosa of the cheek from the inside. Pay attention that these fibers are sensory fibers and they do not innervate musculus buccinator. Finally, the last branch of the mandibular nerve, nervus alveolaris inferior. At the beginning, this is a mixed nerve containing both sensory and motor fibers. However, here you see the motor fibers detaching from the rest of the nerve, and this is nervus mylohyoideus. Nervus mylohyoideus innervates musculus mylohyoideus and also venter anterior musculi digastrici. The rest of the nervus alveolaris inferior enters the remaining part of the nervus alveolaris inferior enters the canalis mandibularis through that opening, the foramen mandibulae, and within that channel, during the passage through within that channel, gives multiple rami dentalis for the lower teeth and the rami gingivalis inferioris for the gingiva around them. The terminal branch of the nervus alveolaris inferior escapes from the canalis mandibularis through the foramen spinosum and this is nervus mentalis. It innervates the skin of the inferior lip, skin and the mucosa, and the skin of the chin.